All right. I am so happy to be here, everyone. My name is Catherine Reed. I am an art therapist and a member of the Choral program. And Choral is the Colorado Resilience in Arts Lab here in Aurora, Denver, Colorado. We are a National Endowment of the Arts funded lab, and we are really trying to build a bridge between the world of the arts around the country and even internationally, and the world of healthcare. And so what we do is provide creative arts therapy programming for healthcare professionals to see if we can reduce some of their burnout symptoms, to see if we can reduce their general sense of fatigue, and also to create community with those providers using art, using music, using dance, and using writing. And so we've been around for about 4 years, and it's been going really well. We've got our data, and we've got a new article published in the American Journal of Medicine. So look for it there. But this is one of the most exciting things I think we do. We offer this lecture series, and we are kicking off our new academic year with today's lecture. And I'm so excited to introduce our presenter. His name is Bernie Warren. Bernie is he is a doctor, Dr. Bernie Warren, but I think he wants us to call him Dr. Bernie. He is a researcher and founder of Fools for Health and its Clown Doctor programs. Bernie is an award-winning researcher and a teacher who recently retired from the University of Windsor as professor emeritus after teaching in universities all over the world for over 35 years. He is trained as a family therapist, a drama therapist, a dance therapist, and he has held university positions in both drama, theater, and psychology. So we're just really, really lucky to have Dr. Bernie with us today. I want to let you know how this hour will go. First of all, thank you so much for being here and joining us. Dr. Bernie is going to present for about 35 or 40 minutes. And as he does that, please know that your questions and your interaction is really part of this hour. And we are really looking forward to having you ask those questions. I will be kind of the host to ask your questions to Dr. Bernie at the end. So the last 20 minutes will be a question and answer session with your questions through me as the host. So with that being said, I'm going to go off camera and we are all going to listen to Dr. Bernie. I'm so grateful that you're here, sir. Thanks for being with us.
Good afternoon, everybody. I hope you can hear me. There's no way of asking people to put their hands up at the back to find out. I'm speaking to you from a somewhat snowy and blustery Leamington, Ontario in Canada. And what I'm going to talk to you about today is predominantly based on some research that was done through Fools for Health 2004-2008. This is not an academic presentation in the sense that I will not be shoving chapter and verse of academic footnotes up on slides. But should anybody want the references, the citations, or anything like that for anything I say, please feel free to email me at the end because I would be happy to share with you. So the talk is called Laughter Fades, Smiles Linger, and it's really my reflections on 25 years of exploratory research and change moments and humor in healthcare. I want to start by saying that all research is exploratory. You start with an idea. I wonder what you start with a probe or a question. And so in theory, you are looking at things that you don't know about. It is difficult to do that, but the things that I'm talking about today are even more exploratory because they had no reference points whatsoever, as I will talk about later. Children make the best researchers. They're not afraid. This is my daughter and I going Easter egg hunting when we lived in Windsor. Children have no fear. They are not afraid of making mistakes. They're not afraid of asking the wrong questions. Why is the sky blue? Why has that man got his finger up his nose, mummy? Those sorts of things. And they're very quick to tell you when they think that the answer you've given you doesn't make any sense. There was a wonderful experience when my daughter was being taken by her mum across the university campus to meet me. And at that point, I was working as a clown doctor at Fools for Health. And her mum said to her, well, this is the university. This is where your daddy works. He is a professor. And most indignantly, Alora said, my daddy's not a professor. He's a clown. So, Bertrand Russell, the great English philosopher, said that laughter is the most inexpensive and most effective wonder drug. I'd like you to just turn to the person next to you and just smile at them. Because smiling is contagious. Just found this, it's lovely. There's a great deal of research on the possible benefits of smiling and laughter in terms of strengthening the immune system, reducing anxiety, depression, and stress, improving mood, reducing perceptions and tolerance of pain, increasing the flow of blood and oxygenation to the blood, and in terms of improving heart health. And from this research, of which there's been quite a bit over the last 50 years, I suppose, has come the idea that laughter might be the best medicine. So this was in the Canadian Medical Journal. According to my research, laughter is the best medicine. Giggling is good for infections, mild infections. Chuckling works for minor cuts and bruises. And snickering only makes things worse. However, Lickle and Jan Hoberg said, whoever said laughter is the best medicine never had gonorrhea. Luckily, I haven't, so I wouldn't be able to test that out. This is my dear mate, my late great friend, Dr. Peter Spitzer, here in his Dr. Fruit Loop personification. Peter died, unfortunately, a few years ago, but he founded the Australian Humour Foundation, which had clown doctors that worked in hospitals, children's hospitals predominantly in Australia. And before he became a clown doctor, he was doing his medical residency. And he had an episode of literal gut-splitting humour, where he made a post-operative patient laugh so much that the way he told it, their guts exploded and he had to stand there pushing the back in. So there are moments when laughter is not the best prescription or the best medicine, as Peter would have told you if he was still with us. One of the things I'm fascinated by is the whole notion of change moments. Jacques Monod, the great biochemist, put these ideas into a book called Chance and Necessity, talking about why and how things evolve and why basically we get the sort of plethora of different strains of bacteria and so on, amongst other things, and how life evolves. Fascinating book. But change moments occur, they're precipitated by a catalyst. They occur when there's not only a need to change, but also a receptivity to the opportunities afforded by such change, creating a new thing or event. If we didn't have these moments of change, things would stay exactly the same. It's one of the reasons why thoughts, ideas, technology evolves. And one of these change moments occurred on the road to Fools for Health. Fools for Health was created in 2001, 2002. It was precipitated by the Manchester hospital arts project where they had a major international conference called Culture, Health and the Arts. And I was lucky enough to go over there. There were about 800 people at this conference from all over the world, from all walks of healthcare and the arts, including ministry officials from all over the world. And I attended 2 back-to-back sessions. The first session was by Patch Adams, and it's fantastic. Patch is fantastic, but he's incredibly idiosyncratic. Only Patch can really do what Patch does. And then the next presentation was by Caroline Simons from Le Médecin in Paris. And as I was watching her work, I thought to myself, this is the sort of thing that I can bring to my students, to my hometown. And so as a result of that catalyst, I went home and started to develop Fools for Health. And it was an unusual pairing, a marriage between a hospital and a university, between a research and practice. And we started slowly. And when we started, I had to go through this shock of the new. How do you convince someone they need something they've never experienced? So I had to make many presentations to senior management and to what my dear friend Peter would call the shop floor workers, the coalface workers, nurses, social workers, and so on, about the value of the work and why it would be there. And I hired 4 clowns on a 6-week pilot project funded by research monies from both the hospital and the university. And we had planned for this to be a 6-week project, and then we would stop and review the data. After 4 weeks, the hospital came to me and said, "You can't leave. You can't leave. This work is too valuable. We're seeing the effects everywhere." And in a sense, that was sort of a reinforcement of the value of exploratory research, because it showed that something we didn't know about was actually of value. But the problem was, the 4 people I'd hired, 3 had new jobs to go to at the end of August, and only 1 was staying on. And we had a film crew coming in to film the work, because the word had got out throughout Ontario, where I live. And so as a result of that, what is a clown doctor? There we go, clown doctors are, I'll be talking about clown doctors. Sorry, I didn't realize. I can't see my presentation notes. It's very annoying. I had to create this new character. Doctor hadn't a clue. The most honest physician in the whole of Western medicine. You can ask him any question about healthcare. How's the patient doing? Hadn't a clue. When will they go home? Hadn't a clue. And so on. And his motto was either I never remember or I always forget. There I am in my regalia. The major thing I want to talk about and show you work from is, what is the value of a smile? It was a social sciences, humanities research of Canada funded investigation on the impact of clown doctors on the lives of patients, their families, the healthcare team. And it was the first in-depth research project of its kind, as far as I know, anywhere in the world dealing with clown doctors. The primary funding was from SSHRC, but we also got funding from many levels of government, and we ended up with about over $1 million worth of funding for the project over the period of time it was going. So it was quite a big project, and we kept information data, both qualitative and quantitative, on everything. Anyway, so this is what we're going to be talking about mainly. One of the things we looked about was relationships with staff. And the thing that the clown doctors did was they broke up the day, changed the mood of the ward of the hospital, and the relationships with staff were paramount to that. Oops, don't know how that got there. So here's a little moment with the staff
at the hospital.
Okay, there's two little old ladies on the bus, and they've been on the bus for a very long time.
Yeah.
And the one says to the other one, she says, "You know what? I think my butt's asleep." And the other one says, "You know, I know it is, because I could hear it snoring."
At the hospital.
So here's another thing we did with the staff was to just break the mood up with a nurse in one of the clinics.
Yee-haw!
So one of the things that the clown doctors did, especially for the staff, was resetting the clock. They'd be on a 12-hour shift. We would go in, do something light and engage with them and change the mood. Now, one of the things I didn't mention is that the clown doctors who worked for Fools for Health were part of the treatment team. They attended rounds, they got notes every morning before they went to see any of the patients, and they were also allowed to write notes on the patient's chart. So that's an important point. So here's another point we're in. This is just after SARS, this little video, and everybody had been excluded from the hospital. You were not allowed to go, and I don't know what it was like over there in the States, but here in town, no one was allowed in. None of the family, no one was allowed in during SARS. And the clown doctors were the first group of non-essential workers already paid by the hospital, because we weren't paid directly by the hospital, who were allowed back in because we were deemed an essential service. So this is in a clinic dealing with diabetes and metabolic disorders. Yes. So here we go. This.
Hi.
Hi.
Hey.
Turning in.
Guys.
Hey, you got any food? I'm hungry.
You gotta have a food, you're a dietitian.
Oh yeah, they are
You
on a
take
diet
food
all the
away.
time. Yeah, right. They're always on diet.
Yeah.
It's a dietitian. They're always, stopping you eating.
Yeah. Oh, nobody wants surgery here. We'll go find more not
patients. Right.
Yeah.
Hi.
One of the things we did was just stop as we went around. This is one of our "how long is a piece of string" gags with the volunteer staff who are standing around just helping. Now, this was interesting because one of the major things we did as part of what's the value of a smile, because it was such an abstract idea, there was no reference point to measure what's the value of a smile. So one of the things we did was we would sit in the healing garden, here you are, at one of the major hospitals in the area, and simply wave at people who were going up or through the walkway and try and see what would happen. And we'd keep records of the changes. And one of the simple responses was people stopped, looked, and smiled, just with us waving and smiling at them, which we thought was a very positive and immediate response. One of the things clowns did a lot was to help distract particularly young patients, but not only young patients, during invasive procedures. Someone was getting a needle or was having stitches out or put in. That was usually helpful. We were not only at the bedside, but we also were pretty much everywhere, actually. We were in operating rooms and emergency rooms and in wards, trying to help the staff wherever possible. This incident, again, was during that moment of SARS when we've just come back into the hospital. We're a small area, and so most of the major children's cases go to the big hospitals in either London or Toronto. But we were just walking along and we had heard this child screaming just before we appeared, absolutely screaming. And so we decided and they were in an isolation ward, so we had to put on the full metal jacket.
My body
bring back my Bonnie to me. Number 3 all day long, dee 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 dee. Let's do the number, rumba doo doo doo. Let's do the number, rumba doo doo doo. Let's do the number, rumba doo doo doo. Number all day long. Underneath the blankets go all the girls and boys, rocking, rolling, riding out along the bay. Home bound for Morgantown, many miles away. If you're happy and you know it's happy and if you're happy and you know it and you really want to show it, if you're happy and you know it, clap your hands.
For me, this was a major change because this child was heard screaming up and down the ward, and we came in to try to change the mood. And the clear change to this happiness that was there and this clapping of the hands was really a very significant change, I think. Here we are in pre-surge, pre-op. This is Dr. Floretta Cauliflower and I with adult patients.
We have a lot of patients. We get the what do you call that? The lazy.
The lazy Susan.
Yeah.
Lazy Susan.
And we put the one patient here, one here, and then we go back to back like this, and then I cut and she sews.
Stitching and sewing.
Yeah, and we can do 2 or 3 patients at once. It's your tax dollars at work. We have a lot of patients.
So this is one of the patients immediately afterwards was talking about how she found our visit before she went in to surgery so helpful. She was a party clown, as you may gather from her attire on the bed there. Did a lot of work with palliative care, with palliative patients. One of the most important things that Patch Adams ever said was, no one is ever dying. We're all living until we take our last breath. And a palliative care physician with whom we worked fairly extensively said that all I can do is give him, in this case, drugs for pain. In many ways, you're doing more for him than I can. Well, that may be questionable, but it was an interesting sentiment because and this is David Curran from, I think, the University of Melbourne, who made the comment about how humor and laughter have an integral place in this in the process of the last steps that we have in life. This chaplain, talking about our work in palliative care. In this particular picture, we've got 3 generations: the grandmother, the mother, and the grandchild. And I don't know, I think I was doing a strongman act there, lifting up the tin whistle. But the whole point is I think I keep coming back to this resetting the clock notion, that if you're in pain, if you're sitting in an emergency room, because the waits, I don't know the waits are where you are, but the waits here can be up to 12 hours to get to be seen by an emergency room physician. Obviously triaging, if you've got something more immediate, you'd be seen more quickly, but nevertheless, you can be waiting a very long time. And if you're just waiting, if you're just with palliative care, a lot of palliative patients are waiting. One of the interesting things we did one day was the senior palliative care physician for the area had told us to go in and do a circus act in a room with a dying patient. She said, the person has only got a few days left, and why don't you go in and liven it up? And we had been rather reticent because we had always felt that we should be respectful and quiet and soft singing. But Charmaine Jones had said, Dr. Jones had said to us, no, I want you to go in there and I want you to liven up. So there was a whole family in there, and we went in and I did some of my gymnastics, doing up and down the walls, rolling up and down and bouncing off walls. And the whole room was awash with laughter, was almost bouncing off the ceiling. It was a really life-affirming moment for everybody involved. This is another example. These words were from a child. We'd been working with his father, who was only been 40 something and was dying from a very nasty cancer. And we'd gone in and worked with him throughout the course of his illness until such time as he was no longer with us. And the children sent us this note thanking us for being with Dad and with the mom, helping them with these last few moments of life together. One of the things that clown doctors do, and I'm talking about clown doctors, but they're now called medical clowns, hospital clowns, many other things. But my work was with clown doctors. But the research that we did, and again, if anybody's interested in the chapter and verse, I'll be happy to talk to you about this, but not at this moment. Reduce medication use for pain, anxiety, and depression. Increase patient compliance with treatment. Reduce anxiety, pain, and discomfort. Enhance the recovery of patients in long-term care. This is really important. Reduce staff stress and absenteeism, and improve perception of healthcare received. Those two are quite interesting. My friend Peter, with one of the residents in long-term care. Most of the time, clowns in healthcare have been working primarily within pediatric hospitals in large urban centres. About 2001, this started to change. In fact, Fools for Health was one of the first clown programs to change the focus from the pediatric patient to patients in general, to the whole hospital, and then to start to work with seniors in long-term care. My friend Peter also started to do this at the same time in Sydney with the Smile Project. So I always think this is like a totem pole. It's fascinating. So one of the things we did when we went into seniors residence, long-term care, nursing homes, aged care as it is in Australia, was to lose the white coat, because the white coat for seniors, especially for seniors with dementia, was a little disconcerting because it was associated with going to the hospital, and we were entering their residence. And so we lost the coat, lost the doctor before the name, and simply became Tilly or Floretta instead of Dr. Floretta or Dr. Tilly. And these two are fabulous. These two plants are fabulous together.
Yellow bird up high in the tree. Yellow bird, you sit all alone like me.
Just the sheer enjoyment there, I think, is, and this was the activities director was dancing with the gentleman there. So I was just talking about where it's that these are people's homes. I often said when I was teaching students that you have to realize that this is the last place that people will live. This is their home until they are no longer living there. They're taken out of this home. And I also made the point that nobody wakes up at the age of 15 and says, "Oh, I'd really like to go and live in an old people's home for the rest of my life, or a senior's home, or something like that." And it's often the last ditch, the last place that people end up. And you have to be respectful, because this is their home. This is the place that they live.
Dream, 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 when I want you in my arms, when I want you, and all your charms whenever I want you. All I have to do is dream, 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 when I want you. Bravo, bravo.
Bravo, bravo.
Yeah.
Michael Christensen, who runs the Big Apple Circus Clown Care Unit in New York and arguably was the first person to establish clown doctors working in hospitals, used to say that the clown doctors make the rooms sparkle and shine, that more than anything, they change the mood of a room, of a ward, of a hospital. And as I've already spoken about or alluded to earlier, this was one of the things that Fools for Health started to hang on to. We decided to change the focus from the patient to the hospital staff and the hospital itself. The rationale was that the clown doctors, because of reasons of funding, if you were lucky, would end up visiting a patient once or twice for maybe 2 to 5 minutes, very much like hospital rounds. If you were working in elder care, the elder clowns, you might see the person for 10 or 15 minutes twice a week. So the key thing for us was always to change the mood and help the staff, because the staff would be there for an 8 to 14-hour shift. And if we could reset the clock, change the mood, change the feeling in the space, then that we felt, and some of the research validated this thought, that it would have a ripple effect for the rest of the time that the people were working. Here we go. So elder clowns, they're called various different things in different parts of the world, help seniors, even seniors with dementia, connect to their immediate surroundings, recognize family members, remember the past, improve cognitive functioning and communication skills, and increase the quality of life for seniors, their family, and for the healthcare staff who work with them. One of the things we tried to work out is why a clown doctor or an elder clown helped seniors with dementia reconnect to the present, despite the fact that they, for the most part, were not present for one reason or another. And the working theory was it was like a memory bridge, that for some reason the song and the red nose enabled the senior adult who was a little lost, foggy in present day, walk the memory bridge back to their childhood and come back along the memory bridge to the present day, bringing some of their lost thoughts, for want of a better term, back to the present. Now, this had a very short half-life, but nevertheless, it was a very interesting thing that we discovered through this work. Ken Dean, who was CEO, the head of, told us that he didn't want the statistics. I was sitting in Clown at a lunch meeting with him and the senior nursing officer, and we were having a conversation about the work of clowns. It was very early on in the work. And he said, I don't need the statistics because I'm an academic researcher. So I was wanting to give him the statistics and the research and so on, and he didn't need it. He said, just see the effects of the work are palpable, are visual. You don't need to give me all the chapter and verse, the academic background. It was very interesting. So here are some of the findings from the value of what's the value of a smile. Smiles and laughter have the capacity to cross all barriers: age, gender, language, culture, illness, pain. No two patients, residents, healthcare teams, or units are the same. And that's something very important. I have a very dear friend who went across from France to Scotland and tried to import the French cultural clowning style into Scottish hospital wards. It did not work because it was not context or cultural specific, and it was not, in my opinion, it was not paying attention to the specific needs of the individual patient, which goes back to what I said earlier, that clown doctors working with the Fools for Health always got very detailed notes about all of the individuals on the wards that they were going to visit. Patients, residents, nurses, and doctors are all part of the community in which they live, and they're all interconnected. And hospitals are often the focal point of a community, especially in small rural hospitals, small rural communities. And I live in a very rural area. We do have some moderately sized cities in around us, but there's a lot of farming around here as well. The other thing I think that was important is which is connected to all of this, is that every facility should be considered a unique living organism, and each clown doctor program needs to be designed to meet the unique properties of that facility. Sorry, I'm tripping. And that links back to my comment about Scotland and France. As I've mentioned already, clown doctors make hospitals more accessible and user-friendly. There is a ripple effect to the work of clown doctors. Again, we've got research to back some of this up, where the smile lingering, the effects of the clown continue on even after they've left the ward or the hospital or the patient for hours. I always like to think of them as mail carriers, that they're in a small village, they interact with all the members of the village, and they spread smiles and create community in each room and ward throughout the hospital. Nope, got to go back. One of the most interesting things was Fools for Health's Clown Doctor program was evaluated by the Canadian Council on Healthcare Accreditation twice. Once in one hospital and again another hospital. And the work that Fools for Health did in enriching the work of the medical and the healthcare team on site was cited as one of the major reasons the rehabilitation program was given an excellent status. And they were also cited as an example of a leading practice, identifying their work as a standard of care that should be involved or should be used in every hospital within Canada. So this was in 2007, 2008 that this was, we got these comments, which I thought was very, very interesting and very supportive of the work that we were doing. My friend Peter and I believed that this work shouldn't just be in the hands of clown doctors, and that towards the end of Peter's life, he and I worked together to develop programs whereby we trained the staff to use humour and healthcare in their own facilities, rather than having clown doctors come in or elder clowns come in. So this was obviously, when it worked, when it was implied, would change the cost of, because you have to pay. Clown doctors or elder clowns are professionals, they're trained, and so they need a living wage. Whereas if you're simply providing an extra set of skills to people you're already paying to work, that's enrichment. It's value added to the work that's already going on. And as a result of all of this, Peter and I created this book called Smiles Are Everywhere, Integrating Clown Play into Healthcare Practice. That is available if anybody is interested. And so,
Setting a hedgehog by mistake.
If you suddenly turn on,
If you can't eat chocolate cake,
If you got her ass.
your mom is red like a balloon. We really, really wish you get well soon. Get well soon. Get well If you're looking green, if you're feeling blue, if you hear the submarine,
If you're allergic to your mother-in-law,
or maybe just roses.
Or if they diagnose you with lemon ultramicroscope silicovolcanoconiosis.
Oh yeah!
Get well soon. Get well soon.
And even if you're not together at all, decided to stay home.
just so you know.
Get well soon.
Get well soon. Yeah!
And that, ladies and gentlemen, is the end of my PowerPoint. Thank you for listening to this. My email is up on the screen there, and I'll leave that up. But in the meantime, as I can't hear what's going on in there, I will stop and allow Catherine to throw questions to me.
Sorry. Thank you so much. I feel like that was both kind of a retrospective on your work and also really a travel through time. So thank you. And around the world, I think, was that last video from Israel?
Yes, it was. Yeah.
So interesting. And really, you know, I'm working at a children's hospital right now here in Denver, Colorado. And I know the children's hospitals across the country are incredibly stressed with
Yes.
our current crisis of
RSV. Yeah.
yeah, and really more kids needing help than we're, you know, able to provide service to in the way that we're used to providing. So the wait is longer, and the fear and the level of stress is just a really great day to hear this.
On the staff as well. I mean, I was reading this morning about the triple threat where kids are coming inward weakened by COVID, and they're getting both flu and RSV on top of it, and it's causing a lot of problems here in children's hospitals in Canada.
Yes. Yeah. So it's very relevant and very important to hear your presentation today. So thank you, first of all.
You're very welcome.
I'm going to read our first question. We have a couple questions here, and then I have one for you as well, but I'm going to read a question from Deidre Bricker. She asked, will you please clarify the educational background of the clown doctors? Are they MDs as well as entertainers?
Okay, that's an interesting question because it depends where you're looking. There are lots and lots. I mean, there were at the time that this was going on, thousands of people working as clown doctors or medical clowns around the world. There were very few physicians who were clown doctors. Peter, my friend Peter Spitzer, was one. My friend Thomas is also in New Zealand, is also a physician, a PhD MD, who works with the works in Hong Kong and Singapore, and but mostly no. Most clown doctors were trained artists who got additional training, and again, it depends on where you're looking as to what the additional training was. Some got extensive training. I mean, most of the clowns at Fools for Health had university degrees, which part of which was training to become a clown doctor, because at that point, University of Windsor was the only place in the world offering training of that kind within a university. And then additional training, usually from hospital staff, physicians, palliative care, pastoral care, nurses, infection control, and so on. So it really depends on who and where as to what the training was. Yeah.
Okay. Thank you, Dr. Burney. How about this question? Lauren Brennan asks, is there research about the novelty you mentioned, the shock of the new, and the ways in which it is good for you to try new things?
I would say indirectly. I'm not aware of anybody. Well, there probably is, but I'm not aware of anybody who's directly looked at the value of the shock of the new. I mean, the problem with shock of the new is you get both. It depends on personality type as to how somebody approaches new things. There are people who jump off the cliff without a parachute, metaphorically, and others who run as fast as they can backwards in the opposite direction. The thing about the shock of the new, and I had probably as many people turn us down as accept the ideas, is it's back to that change moment. In order for things to change, a person has to be ready, willing, and able to change. So, and I suppose some of Mono's work, which was in biochemistry, really, I suppose, and microbiology, was talking about the evolution of viruses, particularly, and other things like that. So, in terms of human beings, really does, I suppose, depend on personality. And I used to say things like, I was asked once on camera in an interview, said, "But how do you persuade people to follow you, to do things?" And I said, I hit them over the head with the weight of my personality.
Well, there it is. All right. Sam Hubley is asking, and from Boulder, you mentioned how French clowning did not play well in Scotland. Cultural adaptation is important. What were some other examples of when it did not work as intended? And how did those moments reshape your thinking?
I think it's more about cultural differences. Part of my research was I went and visited clowns working in hospitals throughout Europe, particularly, but America as well, and in Hong Kong, Singapore, New Zealand, Australia. So, and one of the things I did was not just look at the clowns, but look at also the healthcare practice of the doctors attending, the nurses attending to the patient as well. But one of the things that stuck in my mind was in Spain, in a pediatric hospital, they did stuff that would never, ever be allowed in a North American hospital. It was medieval with phallic jokes and sexual innuendo and all sorts of things that would never get past here. In fact, would probably land people with the police coming in and charging them. But it was quite eye-opening because the culture there accepted it. The children were laughing, the staff were laughing. It was part of their culture, but it was definitely not part of anything I'd seen in most other places. Don't know if that answers it. They couldn't have done that in New York or in California or Colorado. Let's put it that way.
Well, it's interesting. And it's interesting that you bring up kind of that medieval humor concept, because listening to your presentation, I was thinking a lot about the jester, right?
Absolutely. I mean, if you'd asked me to do a piece on that, I've written about the correlations between medieval fools and modern day clowns and clown doctors working in hospitals. And there's a huge connection. In fact, I've written a paper about that, it got published a few hours ago, but talking about things, everything from the fool's bauble, because a lot of clown doctors use I had a finger puppet or a hand puppet, which is very much the fool's bauble, the jester's bauble, the whole use of music and song and dancing with objects, dancing. I mean, a lot of clowns in hospitals will dance with bedpans or gurneys or IV drips.
Well, and also I think that the role of the jester, I mean, because I've done a lot of study and thought about this as well. And I think about that a jester in a community doesn't just hold or present or engage the humor and the laughter. They're actually the conduit to all emotions, right? And so if you have a community that is generally numb or shut down or emotion free, the jester is the way in to even like accessing your own sadness, accessing your own anger.
Well, yeah, again, I don't want to get too academic, but that you can draw correlations and parallels with the shaman as
Yes.
well.
Yes.
But the thing that's most important about clown doctors is they provide the same role that the King's Fool did, is that they can be the scapegoat.
Right.
So all of if you can't, I mean, children who can't get angry at their parents, who can't get angry at the nurse or the doctor who's looking after them, will often direct their anger and their pain towards clown doctors.
Yep. And
that's part of their role. They are, back to your conduit for emotions, they have to suck it up and take that.
Yep. It makes a lot of sense to me because I, as a creative arts therapist, I run a whole team. So we've got drama therapists, we've got art therapists, and people always say you have the funnest, the most fun, the greatest job in the hospital, which sometimes I agree with, but also they don't understand the amount of trauma that you end up holding or moving through your own system because of what you just said, right? Because you are providing people a way through it that is not just verbal.
But one of the things that we found, and it's self-evident, but but the research actually backed it up, is that this whole thing about the smile lingering, when the clown doctors were on the ward and were smiling, the staff smiled more often. They talked to each other more often. They talked and smiled at and to and with the patients and their family more often. And one of the outcomes of that was that the family, the outcome of their stay, was that they perceived the care that they got more positively.
Yep.
And it's so simple. I mean, I was showing work by professional clown doctors, but towards the end I was talking about these smiles are everywhere, that everybody, if one can simply share a smile, it makes a huge difference. If you smile, I mean, it's very hard some days, paying the mortgage, your father-in-law has dementia, you're dealing with family stress, all of those things. There's COVID around, you disagree with left or right politics, whichever side you're on. There's all of this stuff that's going on, and yet professionally you have to be up. It's Sammy Davis Jr. says, once I leave that door, I have to be on.
Yep.
I'm on,
Okay,
baby.
we do have a few more questions we're going to try to squeeze in, Dr. Bernie. One is from Don Parsons. He says, I didn't see people of color or indigenous people in your videos. Have you had experience with minority populations?
Yes. It's a simple answer. It's just there weren't videos of them. Yes, I've worked all around the world. I've worked with Aboriginals from First Nations in Canada, Amerindians in the States, Aboriginals in Australia and New Zealand, Maori. I've worked with people of color, people of Indian descent, of West African descent, of Caribbean descent. So, Canada is incredibly multicultural. I've worked in Chinese with people, so it's.
Thank you for that.
Just wasn't in the videos.
D. Alexander asks, when doing this clowning, do you do it all day by turns, or how is it incorporated with your regular job?
I should set myself aside from the clown doctors. Professional clown doctors, it's their job, and they work 8 hours a day at it, or 6 hours a day at it, of which 4 to 6 hours are actually in the hospital. Same sort of shifts as the old 8-hour shifts for nursing staff or assistant care personnel. For me, my day job was university professor, and I clowned. In addition to this, I also ran my Qigong practice, my Chinese medicine stuff. So
Nice. Okay, we have 2 more questions. I'm going to see if we can.
no problem.
Get them in. Danielle Koffenberger asks, does Dr. Burney know if his program has shown an improvement in the patient experience? If that was something that you looked into?
Yes. Simple answer to that is yes. All that we took detailed exit poll would be what it would be in the current climate of everybody. We did everybody who was discharged there. Not everybody. We did discharge analysis data for patients leaving the program. The rehabilitation program that we worked on did that a lot. And as I said, the Canadian Health Care Association that accredits hospitals was talking about the role of the clown in increasing the quality of care that was provided. And certainly the information we got, as I was talking about on the pediatric unit, showed that the clown doctors had a very positive effect on the view of the patient and their family in terms of the healthcare they were getting. Now, the one thing I should say as a researcher is the perception may not be the same as the actual care they got, but the perception of the team, of the family and the patient, of the staff and the healthcare they were provided was very positive when the clowns were around.
Okay, we're getting in more questions, Dr. Burney, and I'm going to encourage people, if you don't get your question answered live, feel free to email Dr. Burney. His email is right there. Okay, Theo Eckert asks, what is the work being done to integrate clown doctors into the U.S. medical institution currently?
I have one word: 2008. The collapse of the banks affected everything. So up until that point, from 1992, when clown doctor programs first started to come in, until 2008, there was a growth. You could see the increase in the number of programs, the number of clown doctors available. And since that point, you're a hospital administrator and you have $100,000 to spend. Are you going to spend that on nursing staff or putting a clown doctor program in? And the simple answer is you're not going to spend on the clown doctors. Well, that's so. The only places where I know that this is improving are the Thomas Peckner's program in that he's got all around the world: Germany, New Zealand, Holland, Hong Kong, Singapore, is because he's getting a lot of funding from high rollers, heavy hitters, and the program in Israel, which is basically funded by the Israeli government.
Well, I would like to say, just as a final note, that creative arts therapy programs are growing. As evidenced by my program at Children's, we have doubled in the last couple of years. So I think—
Is that true? Is that true
nationally?
Nationally, because I know there are pockets.
Yeah,
there are certain pockets.
That's correct.
Yeah.
And I don't.
In the states, it will depend greatly on whether it's a Republican or a Democratic political climate, I would guess, as it does here in Canada, depending on whether our Liberal government is in or a Conservative government. The interesting thing in England is a Conservative government tends to support the arts more than a Labour with left-leaning government.
Isn't that interesting?
Yeah.
Well, Dr. Burney, I do have to close us up. I want to thank you so much for this really enlightening hour together. And I want to just let people know that we are now kicked off. Dr. Burney has given us a great beginning to our lecture series, which will happen monthly on Fridays at noon. And our next speaker will be Kathy Malchiotti. She is probably one of the best known art therapists and best published art therapists in the country. And she will be talking with us next month. So hopefully you'll come back and join us, Dr. Bernie, as a guest. And I look forward to everyone doing so as well. And thank you, Kathy and Philip. If you'd like to send your questions directly to Bernie, that'd be great. I am sure that he will be happy to respond. You've been so gracious, Dr. Bernie. I hope everyone has a safe and really nourishing holiday. We'll see you in December. Bye.
Bye-bye. Thank you for listening. Bye-bye. We still live? What's happening?
We're still live, Bernie.
Okay, I'm glad. I thought I shuffled off this mortal coil, but I'm no longer talking.
Probably no. Yes, some people are still listening to us. We'll probably be shut down in a few minutes.
Okay.
Great job, Bernie. Thank you.
Thank you. I hope it was exactly or what you were hoping for, everybody. So
it was great, Bernie. Thank you so much. I'll email you with the next steps.
With the next steps,
the next steps. So we'll keep talking.
Okay, well, that's good. I mean, I know that Mark had talked to me about, because I'm at my best actually running workshops rather than simply giving lectures. So he had at one point alluded to the idea of me coming in and doing something practical with people.
Oh, that would be great. Yeah, we'll definitely talk more on that. Thank you so much for today.
You're very welcome. I'm going to go now. Is that all right? Am I release me from my bag?
Release of your duties right now. Thank you so much.
Okay. Bye-bye. Stay well. Bye-bye.